Today, I want to talk to you about how I go about treating patients who have attention deficit disorder. I've had the opportunity to help thousands of patients who have attention or memory issues over the past 20 years, and I have a recipe that really works. So if you're my patient and you come to me and say, hey, Dr. Fotuhi, I can't focus, I get distracted easily, and I keep procrastinating things, what do I do? The first thing I'd like to know about you is how's your sleep, how anxious you are, and if you have things like headaches or other medical conditions. I find that sometimes sleep is the main culprit for patients who have attention or concentration issues. I have a protocol for treating each of those conditions, and you can watch some of my other videos about sleep or anxiety issues. The second thing I'd like to know is whether or not you have vitamin deficiency, such as B12 deficiency, vitamin D deficiency, or if you have anemia. Certain medical conditions can cause memory and attention issues. So let's say you do not have migraine, you do not have anxiety, depression, and you sleep well, and your blood tests are normal. Now what do we do? You know, there is a very simple questionnaire with about 20 questions that help clinicians make a diagnosis of ADHD versus people who have attention problems due to sleep apnea or other medical conditions. So I'll go through those questionnaires with you to see if you do meet the diagnostic criteria for attention deficit disorder with or without hyperactivity. Let's say you do meet the diagnosis of attention deficit disorder without hyperactivity. In that case, I would like to talk to you about all the natural ways that you can improve your focus and attention without taking any medications. I leave the medications as the last resort. All right. The first thing I'd like you to do is to change your habits so that you only study or only read for 30 minutes at a time. Or if you have really difficulty with focusing, start with 15 or 20 minutes at a time. For a short period of time, you can maintain your focus and you can try to pay attention to what you're reading without getting distracted. And as you get better at it, you can extend the time interval that you read, study, or do other things that require focus and attention. Another thing you need to do is to make sure you exercise regularly. I know that a lot of people with attention deficit disorder also have difficulty with organization, and they have a difficult time finding the time to exercise. But make that a priority, because 3 hours of exercise, whether it's 30 minutes, 6 days a week, 1 hour, 3 times a week, it really does wonders for your brain and how sharp you can be when you read or study. Let's say you do start studying in a short period of time, and you do exercise, and you still think, I'm not so good. In that case, I recommend you try something called Neurofeedback. Neurofeedback is something that's offered in different centers around the country. It involves you sitting and watching a movie, and while you watch the movie, there are sensors in your head which record your brain activity. When your brain activities are optimal, the movie continues, and when your brain waves are not optimal, the screen fades. And something really interesting happens. When the screen fades, your brain figures out that something is not right, and it corrects itself. The brain waves normalize, and that makes the screen continue. And that becomes a positive feedback for you, and the movie continues. But then you get distracted, the screen fades, your brain says, something's not right, the brain corrects itself, and the movie continues. So you get rewarded for correcting your brain, and when you do that for a 45-minute session, you may get 500 or 1,000 corrections, which means your brain starts to figure out, I need to keep my level of activity within that optimal range. Neurofeedback has been shown by many, many studies to work well for treating patients who have attention deficit disorder, and I have separate videos about that you can watch if you're interested. So if you do that, and you exercise, and you follow the protocol of studying in short amount of times, you will see great benefits. In the 12-week program that I have for my patients, I combine all of these, and that's why I see remarkable results. More than 80% of patients who exercise regularly, follow our recommendations for better diet, better exercise, better sleep, and receive brain training and do neurofeedback, do remarkably well. They both feel well and the objective scores for attention and concentration improve. So if you want to see remarkable results quickly, you can follow the steps in my program. And if you don't have time, you could do them one at a time, as I explained to you. The one thing to remember is that you can improve your attention and your focus rather easily, but you need to make that a priority and make sure that you follow the steps I told you to see the results. If none of these things work, you can always try medications like Adderall and take them only as needed. In that case, I recommend that you definitely talk with a neurologist or a neuropsychologist who is familiar on how to prescribe medications, and make sure you don't get addicted, and make sure that you don't have significant side effects such as insomnia. All right, go try it.